Hello, Healthcare Experience Matters podcast listeners. This is your host, Casey Callanan. And before we jump into today's amazing episode with Dr. Nita Magee, I want to tell you a little bit about the Compassionate Leader Certificate taking place February 24th and 25th, 2022 from 9 a.m. to 1 p.m. Eastern Time. Our guest today, Dr. Nita Magee, discusses what she learned in a previous Certificate in Foundations of Compassionate Leadership event when she took it a few months back. Clearly, she got a lot out of it, and we're so excited to share with you today's episode with Dr. Magee. So let's jump into it now. If you want more information on the Certificate in Foundations of Compassionate Leadership event, I am including a link for more information on it. You can also get more information on this event by simply visiting healthcareexperience.org/webinars. That's healthcareexperience.org/webinars. I'm really excited about today's podcast. We have with us Dr. Nita Magee. She's a mental health nurse practitioner with Sonny Montgomery V.A. Medical Center in Jackson, Mississippi. She's been in a leadership role there since 2013. So we're going to discuss compassionate leadership, and I'm going to ask her some questions about this subject. And before we get rolling here, Dr. Magee, please just tell us a little bit about yourself and your background.
Okay, thank you, Casey. As you mentioned, I am a mental health nurse practitioner, have been at the Sonny Montgomery V.A. Medical Center in Jackson, Mississippi for about 26 years, but I have over 30 years of healthcare experience. Earlier than that, I was in the role of oncology, which gave another little piece to compassion, but I've been working the entire time in mental health since that time. And I have 17 years of experience as a mental health nurse practitioner. And as you said, 2013 is when I started my leadership role. I completed my doctorate in nursing leadership in 2013. And that's when, since that time, I've had this position. And I lead for my medical center, the mental health nurse practitioners, or we are called advanced practice nurses. But I function in that role and a clinical role. So I serve dual role.
Well, we will definitely have to have you back on at some point because mental health is such an important topic. I really appreciate the work that you're doing in that field. I want to get your take today, though, more on compassion. So how would you define compassion, and why is compassion needed so much right now?
So compassion is one of those emotions that often are triggered, but if we don't notice it, we tend to miss the suffering of others. So when we consider this concept and why it's needed right now, even from a mental health standpoint, or just in general, I think about the global pandemic and some of the things we're encountering in the world, period. And being attentive makes us have that compassion to where we take actions to relieve that suffering from anybody else. And for me, that makes a significant difference in providing quality care or just being a human, in itself. As a healthcare provider, I've always had that sense of compassion and wanting to help others, but that's partly what attracted me to the profession itself. But right now, it's even more important because, again, I'll say that if we miss the opportunity to be compassionate and to feel what others may feel, we miss that opportunity to make that difference. And just being able to consider others, which leads to ourselves and to sometimes as leaders, staff that we manage, we're able to have those positive impacts.
Outstanding. And given that you are in a leadership role, I want to get your opinion on what does it mean to be a compassionate leader? How would you define that?
Oh, wow. Being a compassionate leader for me in my role and developing is being supportive and encouraging those staff that I'm responsible for influencing or even leading. I believe that it builds those connections that we need that for me makes my job a little bit easier because I do consider myself a role model to them, and being able to consider their well-being and them being successful is part of being a compassionate leader. Part of it is being able to be familiar enough with them. And I know my staff that when something is off base with them, I'm able to kind of identify it and be able to step in. And sometimes that means just listening and being able to the phrase, meet them where they are instead of being at that leader's role. And for me, it builds that trust. And because I am aware, they trust me enough that if something is going on or something is occurring with them, even in the workplace or outside, they know that I'm going to give them that support, and I'm going to bring to the table what they may need to help solve that or just ease it up a little bit. And again, I'll say sometimes it's just me listening and being attentive and shutting my computer down, turning my chair around and looking at them. So that being able to connect and them visually knowing that I'm able to connect and that I am listening, that's to me a compassionate leader.
You hear the words compassion and empathy thrown around a lot. Perhaps they're used interchangeably, maybe incorrectly. So I want to ask you about the difference between compassion and empathy and what do you think about that?
Well, I will honestly tell you, before I took the compassion leadership certificate, I am one of those individuals who thought they were the same. But I've developed an entire new sense, and being able to separate them, I know they're not the same. They're totally different. They're dependent on each other, but they're totally different. Empathy is important. Again, I'll say, don't get me wrong, but empathy helps us develop those human connections. But without compassion, we're just feeling them or feeling whatever is going on. But the compassion part is taking actions. Now, what can I do? What do you need from me? What next step do I need to take to make this better, if I can make it better? And it helps us to lead to understanding of just taking those deliberate actions to be empathetic, but compassionate at the same time. Empathy by itself can offer where we're more impulsive and we react and we're not genuine sometimes with the actions that we're taking. As a leader, we're able to recognize the differences, and that in itself, for me, engage and inspires the people that we're leading.
That is really well said. I think it completely makes a lot more sense in my mind now. And I think hopefully some of the listeners who were unclear on that, it'll make more sense now as well. That's definitely well said. How would you define self-compassion?
Self-compassion is a struggle for me personally, but self-compassion is being able to recognize when something is wrong and treating myself or considering myself as I would somebody else. So the staff that I manage, I may be supportive and all of that, but do I really look somewhere for support? Do I look at the things that I need to be successful in my role? And just that self-compassion means that in difficult times, I don't just ignore it and say, oh, it's an in the meantime matter, or that I expect it to just disappear, or either say, this is temporary, move forward. So just kind of being able to understand that I am human, understanding that it allows me as an individual to be able to recognize when I'm not perfect. If I failed at something, accepting that imperfection or that failure, and how can I change it? And knowing that, being able to identify life experiences or even understanding that they help me grow as a person and as a leader, I think that helps develop my self-compassion and therefore my ability to be a compassionate leader.
Excellent. And habits. What are some compassionate leadership habits?
Again, I'm going to refer back to the compassionate leadership experience that I had recently. I always knew that it was some type of leadership style, but I was reminded that compassionate leadership is a servant leadership style. And that as a compassionate leader, serving others for the greater good or making decisions for the greater good is part of being a compassionate leader. And oftentimes it's difficult to have that serve first mindset, but it's an important habit to have to be a compassionate leader. The compassionate leader is one who begins with first respecting myself and then taking actions with purpose. As a compassionate leader, that individual would serve instead of command. So being that kind of leader that can know that you're serving and not just passing out orders or giving direction, it's the way we can deliver that message through demonstrating humility. It takes a sense of humility, and just demonstrating that humility, I believe it inspires and influence others. This type of leader can serve as a role model and help build a compassionate culture. The compassionate leader is also positive and forward thinking. And we're always looking for ways to enhance the development of the staff that we are responsible for leading. And this habit helps explore the other individual's strengths and values. And in turn, I've realized that it unlocks their potential. They're more creative, and they tend to have a sense of purpose and follow the guidelines and the expectations that are set forth.
As a leader, you are certainly familiar with workplace culture. So as far as you see it, what are some traits of compassionate workplace culture? What are some good signs?
Some good signs would be assuming positive intent, listening to the staff and coming in, not being judgmental and not having those grimacing and those facial expressions of disagreement, just actively listening, understanding that there are some times that it's going to be a difficult decision that needs to be made, but empathize at the same time. I'll go with the empathy compassion combination, but being sympathetic, empathetic, and embracing the different views that others may have. And as I mentioned a moment ago, shutting my computer down, turning my chair around, actively listening means that I'm present. So being present is very important. And sometimes taking that step back and just slowing down, even if that means me leaving my office, going to them, being around, making my rounds, being away from areas that may distract me. And I can just tell you in my workplace, we have Microsoft Teams, and the little noise that comes from that, or either from the telephone ringing. So I will try to eliminate as many distractions as possible if I'm meeting with them. And I also tend to be more quiet, is what I'm going to say. I'll go back to the actively listening. I may not make a decision right away, so that that decision may take other people's views, but I let that person know that I'm respecting their views and that I am being consistent with what I'm offering and not just reacting off of what they're coming with, because it could easily be another idea or a situation, or could it be something that is in the background for whatever is going on. So the next thing I would say is self-awareness and taking care of ourselves. And I am learning to do daily self-care. I do the morning meditations. I do my morning communion, which from a religious standpoint, not offending anybody, but that's my practice. My morning communion and just mindfulness. So taking some of the steps to take care of myself so that I know that I'm at the top of my game to be able to offer the best management and the best leadership that I can, and with a goal of being a high performer. And then that way they can see it, and I'm available to the staff whenever I need to be. And I believe that helps to reduce the errors that could be made. And then also just I want to make it very clear that I acknowledge, whoever's listening to this, that I acknowledge that it's difficult, but an important thing to remember is learning how to balance work outside of in the rest of our life, being able to figure out where to draw that line. And as a compassionate leader, we may internalize a little bit more than some other leadership styles, but learning to separate the two will allow us to take care of ourselves. Whereas in healthcare, and I can tell you mental health, we're good at telling our patients, I need you to take care of yourself so you can take care of others. So that same type of thing kind of fits into being one of those habits that we should have.
Yeah. And consistency is something that I really think shines in what you were talking about when you talk about your routines. And I don't think that stuff happens overnight. I think it takes time. I might be wrong, but why is it important that we strive to be consistent with compassion?
Because when we're consistent, I truly believe that it builds that trust that the staff needs in us. And they know that if a decision is made, like I mentioned a moment ago, making that difficult decision, they know that making that difficult decision is in the best interest, and that they're at the forefront of what that decision is, that I'm not showing favoritism, that I'm not being rough on them, that I'm doing what needs to be done. And that trust building part, like I said, is there. But I also presented to the team I manage a discussion about compassion fatigue, because one of the things that I was noticing was not that they weren't caring and not that I wasn't caring, but it was just difficult. And it was leading to some burnout. And there was some staff that I noticed was taking a little bit more time off than needed to be, or that they normally took. And because I review charts, being able to notice their documentation had adjusted, some of the decisions that they would have made beforehand. So because I am consistent and I strive to be consistent, they know that if I come to them with a concern, or if they come to me, some actions are going to be taken. So I'll say again that trust building just adds on to how we can be effective as a leader, and how we can let them know that we're genuine in every action that we take, instead of it being punitive and not being positive, that even though it may seem a certain way, that it's not, and that we're able to adapt and to quickly change whatever comes. We're able to adjust, and we're able to guide them through those adjustments that need to occur.
Is it true compassionate leaders create stronger connections between people? And if that is true, does it possibly contribute to lower rates of employee turnover? Because I know that is a big topic of concern right now in our field of healthcare.
I will say from a personal standpoint, yes, it's true. It takes that wisdom and that self-awareness to help build the one of the attributes of being a compassionate leader. But having that deeper understanding helps build that connection with people. They know that you're more than an individual behind a chair typing at a computer, giving them their proficiencies and evaluating them, or either you have more years of experience than they do. They know that wisdom that you bring along with it is what you're leading with, and they trust your leadership, and you understand with motives. I'm going to say that with motives, they understand that you're leading and you want them to be successful, and you're connecting with them to where if they call you, they're not afraid to call because they don't know what to expect. By creating that connection, you're able to be that ear, be that person, that sounding board is what I call it. You're able to be a little bit more present in giving that feedback. Even if it's tough, you're able to build that connection with that person to where they can take that and know, okay, now what can I do to be better? What can I do to develop? Because as a leader, you are trying to help that person develop. It may be professional, it may be personal. You may have some things that you can offer that will help enhance, and in turn, not about making my job easier, but it does, because I'm not having to put energy into something and not able to prioritize what I need to prioritize. So that connection, that stronger connection that you develop with people, not just in the workplace, but that connection helps make it a little bit easier. And I think that having those attributes and habits as a compassionate leader helps develop that.
Ladies and gentlemen, you have been listening to Dr. Nita Magee. She's a mental health nurse practitioner and manager with GV Sonny Montgomery V.A. Medical Center in Jackson, Mississippi. This has been an excellent conversation. And as we work towards wrapping up here, Dr. Magee, do you have anything else or any final thoughts you'd like to leave us with before we close it out?
Well, what I would like to say is that I know you all have heard me mention a couple of times about the Healthcare Experience Foundation and the Compassionate Leadership workshop that I attended, or certificate program. But what I will tell you, if you have not tried it and have not attended, I'm going to tell you too. For me, the workshop helped to narrow down what I was doing right and the steps that I needed to change to become more of a compassionate leader. I believe, and when I talk with the staff, they told me that I do have those attributes and those behaviors, and that I have a level of trust with them. But being able to identify how important I am, and that beginning with taking care of myself first, and then the workshop allowed an opportunity. It's very interactive. It allowed an opportunity for me to communicate with other leaders, and it eased my anxiety of thinking that I was the only one feeling certain things or feeling alone, and being able to, the word I'm going to use to describe it is phenomenal. It was a phenomenal experience. I used the journaling and the techniques and the things that I learned from the workshop. So even if you have to read up on becoming a compassionate leader and understanding what it is to be a servant leader, by putting others first, I actually am taking care of myself. So that's what I will lead with, because it was a professional change in experience for me. And it has helped eliminate a lot of anxieties and stress.
Dr. Magee, thank you so much for your time. And for those that may be interested, the Certificate in Foundations of Compassionate Leadership workshop will continue. Its next session will be February 24th and the 25th, 2022. So for those listening, there will be information on that I will include in the description of this podcast episode. So be on the lookout for that. And of course, healthcareexperience.org for more information as well. Thank you again so much for your time, Dr. Magee.
Thank you for having me.
Thank you for listening to today's episode of Healthcare Experience Matters. Healthcare Experience Matters is brought to you by the Healthcare Experience Foundation. To learn more, please visit healthcareexperience.org. That's healthcareexperience.org.